Movement disorders are a group of disorders that affect how we move. Broadly, we split them into two different types. When we talk about movements, we talk about a decrease in movement, which we term hypokinetic movement disorders. And then we have a group of disorders that have extra movements or excess movements that we term hyperkinetic disorders. We have 3 movement disorder specialists in our clinic right now. Myself, that's Tuhin Vermani. We have Dr. Tall and Dr. Lotia, who are also movement disorders trained.
The most common movement disorder overall is a tremor. So whenever somebody shakes or has a condition where the particular body part is shaking, so the tremor is the most common movement disorder. Followed by that, usually it's dystonia. Dystonia is a condition where there is abnormal twisting, turning of a part of a body. It could be like a neck or arm, especially when they try to use it, and followed by some other involuntary movements like a chorea or stereotypy, often tic disorder. So these are all the ranges of involuntary movement disorders.
When we think about causes of movement disorders, we can broadly classify them into inherited or genetic causes, neurotransmitter defects or metabolic issues causing movement, abnormal movements, or degenerative causes. Amongst the inherited and genetic causes, there are some disorders like Huntington's where we understand clearly that there are specific gene defects that lead to the presentation, manifestation of Huntington's disease. Same for certain types of ataxia syndromes. There are other disorders where we know there's an inherited component. For example, in essential tremor, we know that there's a strong family history in about 70% of the people, but we don't understand what exact gene is associated with presentation of tremor in many of these people.
The advantage of getting your care, at least especially in Arkansas, at the University of Arkansas for Medical Sciences in our movement disorders clinic, is that there are 3 of us neurologists that are trained, fellowship trained, where we do an extra 2 years of training in movement disorders specifically.
We can provide a number of complementary ways of understanding your disease process and altering it in the long term.
We also, being an academic institution, keep up with the latest trends in treatment for different movement disorders, and we also have a lot of research going on.
In addition, the ability to interface your care with physical therapy and occupational and speech therapy modalities to address the whole host of physical changes that are associated with Parkinson's or Huntington's disease are not available elsewhere, where you're just going in to see a general neurologist for your care. Lastly, we have resources through the Cure PSP Foundation, through the Parkinson's Foundation, for improving the awareness and ability to fight these disorders.
The most important thing that the patients come to us, and the first and foremost, is getting the right diagnosis, because a lot of times, obviously, the treatment depends upon what the diagnosis is, and it can really change the trajectory of their lifestyle. Even though we may not have a cure, there are a lot of medications and other adjustments that can be made to have a very good quality of life. So treatment options range from as simple as trying a medication or getting rid of a medication that may be causing a movement disorder, versus considering some other options such as botulinum toxin injection. So for a variety of these movement disorders, we offer botulinum toxin injection, which is basically, one of the name is Botox. And then for more advanced patients or patients with more severe movement disorders, some patients may be eligible for invasive procedures such as getting a deep brain stimulation.
As a clinic nurse in movement disorders, our job is to facilitate care for the patient, to assist our physicians, our providers, our advanced practice nurse with whatever's needed for the patient. If it's help with the referral, if it's help with education, if it's help with hooking them up with support group information, with exercise information. A lot of our patients are on special medicines, and we work really hard to try to help them get those medicines. And sometimes it takes a lot of back and forth, but we do want to help them with anything they need.
When it comes to research for movement disorders, including Parkinson's and Huntington's and essential tremor, we have a very active clinical trials program in addition to some of the research that my partner Dr. Vermani does on assessing in the long term how walking progresses and how cognitive changes influence a number of factors in the presentation of movement disorders.
We are heavily focused right now on Parkinson's disease and determining why some people with Parkinson's disease develop a particular problem in their walking where their feet get stuck or glued to the ground. We don't know a lot about this right now, and so we're trying to figure out why some people do and why some people don't, and hopefully in the future this will allow us to target therapies to help prevent this difficult problem from developing. We have a human physiology lab where we have different types of sensors that track your movement of your arms, your legs. We track how people write and how their finger movements move over time using data gloves. We have accelerometers that look at how you walk and how well your feet move over time, and we also have a gait mat, which is a 20 by 4 foot sensor that helps track how well your feet are touching the ground.
Some of the trials that we have now here at UAMS include changing the way your body metabolizes or your nerve cells metabolize energy to try and reduce the progression of Parkinson's disease. There are other groups that are looking at specific gene-based interventions in Parkinson's or changing the way that alpha-synuclein clumps in the brain to help reduce the risk of progression of Parkinson's disease.
One of the important aspects of our clinic is also the education. Being the state's only academic neuroscience center, it is our duty to help educate our future neurologists and even other providers. So we have medical students who rotate with us on routine basis. Our neurology residents kind of go through this training, and residents from other departments such as family medicine and neurosurgery also rotate with us to kind of get a exposure of these somewhat complex patients, so that at least they can handle the basic necessities on their own. I think the other important part of a clinician is also educating the community and our patients. So with respect to that, we have at least once a year an annual symposium that is dedicated towards the patients with Parkinson's disease and their family members. And I think that's very important that we continue to educate not only the patients but their loved ones and even community providers. And we've done that via different medium where we have gone and presented at different conferences within the state, as well as used our digital health medium and learn on demand to coach other providers in the state.
I think with our whole group, hope is one of the bywords for us, I think. We want to instill hope into our patients, to be there for them in any way. When we see patients thriving, we're very happy, very happy. We want to let them know that we're there for them with whatever they need.